Kirby-Bauer test for antibiotic susceptibility by Michaela Hubbard. Why is the Kirby-Bauer test used? It helps determine what type of bacteria that is resistant to certain antibiotics. During the sensitivity analysis, it will help your physician decide what antibiotic eliminates the infection in the body. Why is the Kirby-Bauer test important? This test has become a very important step to treat patients for their infectious diseases and will help monitor resistance. When choosing the antibiotic, it will be taken into consideration with the pathogen, pharmacology, needs for antibiotic therapy, and the cost effectiveness. A newer method of the Kirby-Bauer test was created because the original was incapable of producing quantitative results. The new method of the KB test is known as MIC. It stands for Minimum Inhibitory Concentration. This helps to evaluate how well antibiotics will work towards the infection. When reading this, there are several different representations to look at. White circles mean that there are no bacterial growth. Blue circles will portray bacterial growth. The lighter shades indicate less, while the darker shades represent more. There are black lines on this test, and they are located in each row. It is known as the break point. Purple stars will indicate the MIC for each antimicrobial. This is the lowest concentration at where the bacteria are susceptible to the antimicrobial. A dilution method is an estimate of antibiotic activity. The antibiotic can be diluted by including the broth or agar medium. Then it is inoculated with the test organism. This is the lowest concentration that can stop growth after putting it in the incubator. Afterwards, the MIC is compared with the known concentration of the drug in the serum. Some important terms that you need to know is that susceptible is when organisms are called susceptible to an antibiotic when the infection responds to treatment with the drug at the right dosage. Resistant refers to when the organism is expected to not respond to the given antibiotic. A lawn culture is a term used by microbiologists to help describe the appearance of bacterial colonies when the individual colonies on an agar plate merge to form a field or mat of the bacteria swabbed. A Muller-Hinton agar plate is a microbiological plate that's used to help isolate bacterial colonies. It also allows for better diffusion of antibiotics than other plates. In this experiment, I am using what is known as sheep blood. Materials that you'll need is 1 Muller-Hinton agar plate, a 24-hour-old culture, sterile swabs, antibiotics, sterile gloves, and a metric ruler. My objective is to determine susceptibility of bacteria found in a throat culture to different types of antibiotics. First, dip a sterile swab into bacterial suspension. Then take the swab and streak the agar plate to form a bacterial lawn. When streaking the plate, use the swab at an angle and rotate until all areas are covered. You should allow up to 5 minutes to dry. On top of the plate, you need to section areas off for placement of antibiotic disc. Then separate the antibiotic discs within equal distance of each other. After that, place in the incubator at 101 degrees and leave for 24 to 48 hours. Then remove the plate from the incubator and check for zones of inhibition. The zone of inhibition is an area where bacteria is not able to grow because the antibiotic disc inhibits their size. If there are several areas of inhibition, you should measure the widest diameter from one edge of the zone to the other edge. After you measure, this will determine if the organism is sensitive, resistant, or intermediate. The antibiotics that I used in this project is ampicillin that helps treat bacterial infections, tetracycline, it treats acne and skin infections, ciprofloxacin, it treats infections, Vancomycin, which treats infections. An example of this is staph. Gentamicin, it treats infections, and another example of this is a urinary tract infection. Novobiocin, it helps treat infections that are in the intestinal area. In conclusion, during my Kirby-Bauer test for antibiotic susceptibility, I had a clear area of inhibition from ampicillin 10 mg. This proves that the bacteria is sensitive to this antibiotic.